Hi, this is Duncan Ferguson. In this unit we're going to talk about the sort of global effects of glucocorticoids on the animal, and we're going to focus on the physiological effects, but you'll see that we're getting also into some of the effects that are associated with excess glucocorticoids and therefore pathophysiology. This unit's going to be a little bit longer, but I wanted to give you basically the whole picture of the things that we see clinically, and I think if you understand what we're talking about in this unit, you'll be in very good stead to understand what to expect with regards to how glucocorticoids are used to in the body to sustain normal physiology, but also what happens when the hormones are lacking or hormones are in excess, and that's really important for a clinician. Let's first talk about the effects of glucocorticoids on water balance. In general, you can think of them as being very important for sustaining the extracellular volume in the body. Secondarily, because of that volume, they will also increase glomerular filtration rate, that is the fluid filtration rate by the kidney. Sometimes people forget that optimal amounts of glucocorticoids are important for not only dilution but concentration of the urine. And so maximal dilution of the urine requires glucocorticoids, meaning can you take the urine and take it from what we call a fixed specific gravity to a dilute specific gravity. That is allowing the body to get rid of excess fluid when it needs to. Exogenous glucocorticoid administration, we know, has effects that are like mineralocorticoids, which is to increase sodium reabsorption and potassium excretion. And very importantly, particularly when we're thinking about using glucocorticoids from a pharmacological standpoint, glucocorticoids can inhibit both the secretion and release from the posterior pituitary of antidiuretic hormone, also known as vasopressin, and it can affect the action of vasopressin in the renal collecting duct. And so it has this dual effect that leads to what we call polyuria and polydipsia in the animal. Okay, now let's focus on the effects of glucocorticoids on the cardiovascular system. And I want to point out that it has sort of permissive roles in terms of the regulation, meaning that physiological amounts are important for the appropriate synthesis, if you will, of beta-1 receptors, adrenergic receptors in the heart, and also in the alpha-1 adrenergic receptor in the arterioles. And we'll go through each of these and its relevance to the animal as a whole now. Beta-1 receptor is important in terms of increasing the heart contractility, the strength or inotropic effect, and they're also, because they're in the SA node, are important with regards to the heart rate. So having glucocorticoids be present has optimizes the effect of the adrenal medullary secretions, the catecholamines, like epinephrine and norepinephrine. Let's look at the effects on the blood vessels. Alpha-1 adrenergic receptors are key to that adrenergic effect in terms of sensitivity and contractility, if you will, that helps to maintain blood pressure. So glucocorticoids help support this effect by supporting the synthesis of alpha-1 receptors. They also have an effect in the renal arterioles through different mechanisms to increase renal blood flow and glomerular filtration rate. And they also, in a general way, sort of their almost anti-inflammatory way, help reduce leakiness of the blood vessels, reducing the tendency for loss of proteins and fluid outside of those vessels. And of course, I'm going to keep repeating this, even glucocorticoids have mineralocorticoid effects, and that means saving sodium and loss of potassium is stimulated. One of the reasons that glucocorticoids are called glucocorticoids is their influence on glucose metabolism. It's important to kind of think about the fact that glucocorticoids are essential for surviving a starvation condition. So when you have no food, if you look at all the effects as we go through these of glucocorticoids, they are to help the body increase its energy, production in a situation where new nutrients are not coming into the body. So what are these? Well, they increase gluconeogenesis, and they do this by stimulating gluconeogenic enzymes. So what does that mean? That means that they're taking proteins that have been broken into amino acids, and those amino acids are then converted to glucose. And so you're seeing that by breakdown of protein, that catabolism of protein, and then the gluconeogenic enzymes basically lead to the production of a carbohydrate for energy. They also glucocorticoids antagonize insulin's effect to lower blood glucose. That is what we often hear about in situations called insulin resistance. They increase the amount of insulin that's needed to put glucose in the cell. And we'll talk about insulin's effect in a different unit. They also, glucocorticoids, enhance glycogen synthesis. So this is kind of an interesting juxtaposition. Maybe it doesn't make a lot of sense, but they're helping to increase glycogen synthesis by stimulating the synthetase enzyme. And this becomes perhaps more important in the excess situation of glucocorticoids, like hyperadrenocorticism, where we see hepatomegaly, enlargement of the liver because of increased glycogen, but also, as we'll point out, increased fat in the liver. So on this slide, let's focus in on the protein metabolic effects of glucocorticoids. And on the right, we have some of the biochemistry going on, and also at the bottom, a dog with hyperadrenocorticism. So you can kind of see the whole picture of an animal being affected by excess glucocorticoids. But let's look at the biochemical effects. Glucocorticoids decrease protein synthesis, for instance, in muscle. And they do this by reducing amino acid uptake and increasing gluconeogenesis. And that increased gluconeogenesis, as we said in the previous slide, leads to the use of protein, and most of it's in our muscle. So we get a muscle wasting situation and a pot belly, which is shown here, and a dog with Cushing's disease. What does that pot belly due to? It's due to increased glycogen and enlargement of the liver, but it's all mainly due to weakening of the abdominal muscles here, and that sort of sag that you see in the dog, that's what we call a pot belly. There are other effects, which we'll talk about later, on the skin as well. And so if we focus back to this schema here, you can see that the liver is able to take alanine that's produced from the muscle and put it into, convert it to pyruvate and then to glucose. This is details of biochemistry, but the side product of all that gluconeogenesis is found in also urea that is excreted. What about lipids? The effects of the physiological actions of glucocorticoids on lipid metabolism are to be permissive for hormone-sensitive lipase, sometimes called HSL. And this would basically increases plasma glycerol and free fatty acids. This is a metabolic effect. With excess glucocorticoids, we see a fat redistribution, which is reflected, as I showed in the previous slide, in enlargement of the liver, hepatomegaly, with both lipid and glycogen. And redistribution of fat we sometimes can see as a buffalo hump, a crusty lipid deposit in the neck area in humans and also in horses. We call those horses crusty, but it's one of the hallmarks of an animal that has possibly hyperadrenocorticism. And at the right you can see a liver that is being affected by glucocorticoids. You see sort of a micronodular cirrhosis, which is due to chronic increase in and chronic enlargement, and also the deposition of lipid and glycogen. Here in this slide, sort of as a preview for why we use glucocorticoids for anti-inflammatory effects, I'm going to talk you through an example we gave in a different unit in a more cellular level. That is the effects of glucocorticoids impacting the protein lipocortin. But it's important to recognize that this effect is not just a pharmacological effect, it's also a physiological effect, and it is occurring in a balance all the time within the body. But it's also important to recognize that this stimulation of lipocortin and suppression of the enzyme activity secondarily of phospholipase A2 characterizes the very potent anti-inflammatory effect on mediators of inflammation of glucocorticoids. And so if you see, we're producing, by suppressing arachidonic acid, not only do we reduce the prostaglandins and prostacyclins over here, which would be accomplished by things like nonsteroidal anti-inflammatory drugs, but we also affect the lipid mediators, the chemotactic lipids, through the lipoxygenase LOX pathway here. By reducing the substrate, we reduce the attraction of white blood cells to a site of inflammation, and that's a key anti-inflammatory effect of glucocorticoids. So let's drill down on the cellular mediation of inflammation in those parts of it that are affected by glucocorticoids. Glucocorticoids inhibit the production of interleukin-2, IL-2, by helper T cells, and they inhibit the production of T lymphocytes. And we see this in the CBC, complete blood count, with lymphopenia, a reduction of white cells, the lymphocytes, a reduction of eosinophils, and an increase in monocytes. In addition, and this is a separate effect, mature neutrophils generally hang out in the peripheral vasculature. They're sort of sticking to that, and we call that they're marginated, if you will, into small vessels. But what glucocorticoids do is to reduce that stickiness and leads to demargination, and and that leads to increased amounts of mature neutrophils. And we call that basically a stress neutrophilia. And that stress neutrophilia is pretty typical of many of the species and are characteristic of animals that have been under acute stress, and something to look for in the complete blood count. Glucocorticoids also increase neutrophil release from the bone marrow, and they decrease movement of neutrophils out of the vascular compartment. That means they keep them from getting into the tissues where they can have their effect. That's why they're anti-inflammatory. In addition, beyond that, they help affect some of the cellular mediators like histamine that are produced by mast cells, and serotonin that also modulate an inflammatory response. Okay, what are the physiological effects of glucocorticoids on bone and collagen? Well, basically, they do reduce the production of type 1 collagen, which is a major component of the bone matrix. And so as we see, in glucocorticoid excess, because of this, both within bone and outside of bone, this general reduction of collagen production, you can have poor wound healing. And that's manifest in this slide here in an animal that had repeated attempts to suture a wound. And you can see that wound has not closed, and the reason it didn't close is because the animal had hyperadrenocorticism. Glucocorticoids also decreased the osteoblast production, therefore the deposition of bone is reduced. They decreased intestinal absorption of calcium, basically by antagonizing the positive effects of vitamin D at calcium uptake by the gut. In terms of growth in general, We generally say don't give glucocorticoids to a very young animal because you're going to have this reduced bone formation. You also have reduced growth hormone secretion, and you can inhibit the proper linear growth by essentially leading to slowing or even closing of the epiphyseal plate at too early a time point. Throughout this presentation, I've alluded to some skin effects of glucocorticoids, and I think the way to sort of simplify our thinking about it is to know that glucocorticoid receptors exist in hair follicles. Proper amounts are important for keratin production. That's the physiological effect. But we also know that excessive amounts, and we see this in dogs and cats, will lead to an increased amount of the resting phase of the hair follicle, and that leads to the bilateral symmetrical alopecia that you see in dogs and occasionally see in cats, but it's more common in dogs, where you have flank loss of hair and lack of replacement on both flanks. This is in contrast, interestingly enough, to excess glucocorticoids in horses, where they actually develop hirsutism, which is a sort of long, curly hair coat associated with hyperadrenocorticism in the horse. So some take-home points for you would be to remember the physiological effects of glucocorticoids include regulation of circulatory volume. Part of that's also involved in maintaining cardiovascular, both heart and vessel, sensitivity to catecholamines, and modulating vascular permeability or leakiness of the vessels. They have metabolic effects that are key, including stimulation of gluconeogenesis and the hormone-sensitive lipase, but inhibition of phospholipase A2. That's an anti-inflammatory effect. That anti-inflammatory effect translates in part to reduced cell-mediated response or attraction of all those white blood cells to a site of inflammation. This is probably the most important effect that we see and side effect, if you will, of glucocorticoids is possibility of secondary infections. Glucocorticoids antagonize linear growth, they antagonize bone calcification, and they antagonize collagen formation. And we know skin effects are seen in hair follicle cycle disorders or occur differences in species, but they occur as because of the fact there are glucocorticoid receptors in the hair follicle, and they also will glucocorticoids affect keratin synthesis.